Welcome to the Anti-Cancer Intervention video series. Now, you've been diagnosed with cancer, and needless to say, everybody's just flowing in with information to you, and you're getting a lot of information. It could be overwhelming, and who do you trust to give you the right information? Now, I'm going to share with you in this video series how we had example of bladder cancer disappear in only 2 minutes. Now, if you stay tuned with this video series, you're going to get to know the reasons for cancer. We do not want to just go address the symptom, because cancer is just a symptom. We have to look at the cause, and that's what I'm going to help you to find. Finding the cause of the cancer. Then also what you can do about it. Now, it doesn't help you know what the cause is, but you don't know what to do about it. So we're going to go through this step by step. I'm not going to go very fast so that you can understand it. Once you understand it, you know what must be done in lifestyle changes and other treatment therapies that might be available. If you see the amount of money being spent on cancer research, cancer support, one would expect that cancer will be declining and the people surviving cancer would be increasing. But unfortunately, it's just the opposite. And we must start asking ourselves the question, what is going wrong? Now, if we just take, for example, the Journal of Oncology, Global Oncology, stating that as much as 44% of all cancer patients are misdiagnosed or undiagnosed. The National Cancer Institute even admits in a report that millions of people are treated falsely for cancer. Now, needless to say, you do not want to hear this type of information, but it's the reality, and we have to deal with that reality. So we're doing something wrong, that there is not a decline in cancer, but there's an increase of cancer. And I believe the reason why we're not winning the cancer is because we're treating the symptom, being cancer. We are treating the symptom and not the cause. If your water looks like this and you need to drink from that stream, you're going to have to treat the water every single time, unless you go to the origin of where the water's been polluted. This is what we're talking about in cancer as well. If we're going to treat all the time the cancer being the dirty water, we're all the time going to treat for cancer. But if we go to the origin, the reason why the cancer can be there, then there is no cancer. So this is the whole focus of the video series, to find the origin and then what to do about that origin. What are we going to do about it? This is the type of information that we're going to be sharing with you. Now, I've gone through this with my own father having cancer. He had cancer, prostate cancer, and just stand so as you can see, that was when he had prostate cancer. They cut the cancer away and said you're 90% clean of cancer. To take you to 95%, we would like to give you chemo. And he denied taking chemo. At that time, I did not have much information about cancer. And I said to him, Dad, please go what the doctor says. Take the chemo. And he said to me, go do the research and tell me, once you've done the research, whether you want me to still take cancer. Now, the long story short, 10 months later, he's back into the hospital with the same cancer spread to his lungs and his bone. And what was the first words that when my father heard this, what was the first words? He asked the oncologist, can I have chemo? And the doctor said to him, it's too late. We're not going to help you with chemo. We cannot help you with chemo. We're sending you home with oxygen and with pain medication. The cancer being in the lungs is going to feel like you're drowning. The cancer in the bone is going to be painful, so it's going to be oxygen and pain medication. That's where I said, medicine just failed us as a family, and said, let us go find a reason why my father can still stay alive. I found the reason, and as you saw there, 2 months later, he's cancer-free. And we're back as a family healthy. That is what I'm going to be sharing with you. showing you how we can get to the point that you can also be cancer-free by treating the origin of cancer. Now, I even had the blood tests. Now, PSA, blood test must be between 0 and 4. That's the parameters, the 0 and 4. It was 110. Needless to say, very aggressive. And in 2 months later, it was 0.88. These are type of things that I would like to share with you. How do we get that right? Now, I'm going to also share with you, for example, Matilda. She had cancer, and 3 weeks later, she's cancer-free. This is going to be a little bit later in the video series, and say, what did we do? How did we help her to get to that state of being cancer-free? So now, the number one common factor between all our cancer victims is going about the stomach. Now, as many people say, what, the stomach? Yes, the stomach. And I want to talk about the pH. Now, we all know what's pH in a sense where if you go look at the pool, if it's balanced between 7.2 and 7.6, then it's a clear pool. So there's no, it's not going to be green. If it's low pH, it's going to be green. So just to get an idea, so a lot of alkaline, so if it gets too alkaline, then it means you've got too much chemicals within the pool to be able to get it to alkaline. So now you just want to get it to a balance. So we like to talk about the blood pH, the body's pH. All right, let's talk about the pH scale, what the body must have, and all these type of things. So pH of 7 is balanced. So just like the pool, we're talking about we need to get a balance. Very alkaline can be very toxic, like for instance drain cleaner, and then very acidic is digesting. So now, if you look at a battery, it's got an acid. The battery acid is a 1, pH of a 1. If I would say guess where would your stomach be, most people guess it around about here, between, even people saying between 5 and 8. I get that. The stomach pH must be a 1.5. If your stomach is not acidic enough, you're not going to digest the food. And if you're not digesting the food, the cells are going to start going from a healthy cell to an unhealthy cell. So the membrane is going to change, the amount of nutrition that can be absorbed. All these things are going to start changing. The minerals that you need, the vitamins, everything's going to change the environment of these cells. Now the cells die off 1 million cells per minute. So we know a lot are dying off, but they're going to die off easier and quicker if they are looking like this. So we'd like to keep cells healthier for longer, to be able to live longer. Now, what you must not do is confuse alkaline body with an alkaline stomach. Because many people think, oh, I need an alkaline body, so in other words, the stomach must also be alkaline. And they start making drastic changes to their lifestyle, and that can be detrimental. Now, we talk about the blood pH. Blood pH must be between 7.35 and 7.45. Note that if you're too alkaline, it's also dangerous and you can die. Too acidic is dangerous and you can die. So it has to be a perfect balance. And if you're going to talk about your stomach must be alkaline, then you're not going to absorb the nutrition. Now, what controls the blood pH is the lungs and the kidneys. So let's think logic about this. If your stomach is going to be alkaline, it's not going to digest. If it does not digest correctly, it's going to change the kidneys. The kidneys are going to take strain. The kidneys are going to take strain, the combination works with the lungs, and you've got a acidic blood. And that's where the blood changes in the environment where cancer can grow. It's like a greenhouse effect for the cancer. So it's vital that we look at the blood pH. Now, you cannot test the blood pH with a test on the tongue, the urine. Each part of the body has got a different pH test. And fortunately, we have got the equipment that can test your blood pH constantly, every day, well, more than once a day if you need to. But the idea is to make sure that we get to the origin. Why would your blood be acidic? We have to get it to that alkaline state that we spoke about. Now, the worst thing you can do is take the advice of people saying, drink bicarbonated soda, the baking soda thing. So let's think about this. If you drink it, it goes into the stomach and changes that environment. And here's an example how it looks. So you've got this battery, which is an acid of a 1, and your stomach is a 1.5. You take in some alkaline powder, you're changing the environment where the food must be digested. You're making it too alkaline. It's not going to digest. On that basis, you're going to have a decrease of minerals. You're going to be in mineral deficiency. It's going to be a vitamin deficiency, nutrition deficiency, and then the cell starts changing. So this information I'm sharing with you might be totally opposite of that which your doctor might be telling you. Because when you're having acid reflux, the doctor might be telling you you've got too much acid, and that's why it's in the esophagus. Now think about it. If you have got a lot of acid buildup and acid reflux, what's going to happen is it's going to start digesting the esophagus if it is very acidic. If it's not too acidic, it's going to give you some burning sensation, but it's not going to digest. So what happens is the muscle closes if it's going to protect, and it's going to relax if there's no danger. So this scenario is where the muscle has been relaxed and saying there's not enough danger to close up. So if I'm going to punch you on the shoulder, what will do? You'll start crunching up and pull the muscle tight. So now the stomach does exactly the same. It crunches closed so it does not have the acid come up and digest the esophagus. So it's just totally opposite. When you do have acid reflux, you must know your stomach is too alkaline. Now you can test it yourself. Go eat 2 beetroots for lunch and go look if your urine is pink. So once you digest it through the stomach, and you go see, did your urine turn a shade of pink? If it did go to a shade of pink, your entire system is too alkaline. You're not digesting. So then it will go through to the kidneys. And remember what we said? The kidneys help control the blood pH. So in other words, it's going to change the blood pH as well. So now, we spoke about blood pH, but also for the environment of the cell. So now we put in this cell's environment under stress. This stress, we're talking about lack of nutrition. So it's environmental stress. It's your lifestyle that changes it. There's toxins that can change it. So what we need to do is we need to help this cell to be able to de-stress, get healthy again, because the organ and the gland functions is relying on a functional cell. If we're not going to look after our stomach, the amount of acidity, we're going to have organ failure and gland failures, the functionality of that. And that's where the cancer is still going to happen. So if you're going to start stressing, you're not going to be fully functional. The cell is exactly the same. If we're not going to give them the environment which is going to be stress-free, they're not going to function correctly. And we have to do that. So now, let's identify cell functionality. So each organ and gland has got different type of cells. And these type of cells, if we start identifying one of them, and we use a very sophisticated piece of equipment to identify the one cell, record only the one cell sound, and we can also then see how the sound looks like. So we see the resonating frequency. So what I'm going to do is I'm going to show you now 2 different cells. A lung cell of a bad cell, which is under stress, and then one healthy cell. I'd like you to listen to the sound of each one of them and hear the difference. The first one being the stress. Many people say it's just a lot of static. Other people would say it's a radio which has not been tuned. So what's busy happening is it's stressed. It's not going to be a fully functional cell. And if there's a lot of those, you're not going to have a fully functional lung. Going over to the healthy cell, listen to that. Almost like a baby's heartbeat. So what's busy happening here is the cell can function correctly. because that is the correct healthy resonating frequency. Now, part of this resonating frequency is explained very well with regards to people just talking a tumor away. Now, if you do not know Greg Braden, get to know him, YouTube him, lovely information. He shared on one of his series, he shared the video of a medicine-free hospital where the clinician would just talk to the tumor and the tumor disappears. Now you're going to hear the technicians say wasa, and it's going to just be wasa, wasa, and the interpretation is just saying go away, it's already done. So that's busy happening, and I'd like you to listen carefully and note that this is just talking to the tumor, and live you can see on an ultrasound what's busy happening.
The center has successfully treated more than 180 types of illnesses, including bladder cancer.
Okay, so you can see the practitioners behind. You can see the ultrasound, the sonogram technician. There's the woman's tummy. It's exposed. She obviously is awake. Okay, and here's the split screen monitor. On the left side is the snapshot that I was talking about, a freeze frame in a moment in time. And the blackness is the emptiness of the bladder. The lump is the tumor. And the curve is the floor of the bladder. On the right-hand side, now you're going to see the real-time image of the tumor. Okay, and what I'm inviting you to do now, what you want to do is watch and compare what's happening on the right side real-time with the before image on the left.
Isn't that just amazing? Now, once you see that, you'd say that's a miracle. But once you start understanding what just happened, we can turn that into technology. And this is what we're going to be talking about later, is that the what can we do about the cancer? What can we do about the origins of cancer? Exactly the same as what you just saw there is turned into a technology, and I'm going to be sharing that technology with you. Now, I think anybody with cancer or scared of cancer would say, I'd rather want that than something else, than going to a detrimental decision that you have to go take a drug or do some treatment that is detrimental to your cells. Now, we say protect the healthy cells. Don't damage the healthy cells by killing off the cancer cells, because those damaged cells is just going to change the environment. It's going to be a stress again. On that basis, it becomes a second cancer. Now, if chemo would do this or destroy it, it might just also change that healthy cell to a stressed environment. And the stressed environment, as we mentioned earlier, that changes the functionality. Functionality would change the organ, and that's then a recipe for cancer. So these are the approaches that we'd like to go and say, let's focus not on the cancer only, but the environment, change the environment, and also the origins of cancer. So as a recap, the stomach must be acidic. If we don't have it acidic enough, there's not going to be enough nutrition within the body. Trace elements, which is your iron, your zinc, and selenium, these type of things, we're going to change the environment for the healthy cell, and it's going to become an unhealthy cell. So that's the point number one. Most common thing between all cancer victims is going about the stomach not digesting correctly. Now, the whole point is to look at the resonating frequency to identify that. So once you start understanding that, my next video would be able to go into explaining more about the resonating frequency. But my next video is also going to entail the fact that we need to know what is the second most common thing so you can start addressing saying, how do I address this? Just want to leave you with a tip. If your stomach is too alkaline, you had that beetroot and it's too alkaline because you've seen the pink in the urine, you can do a symptomatic treatment by having apple cider vinegar before a meal, half an hour before the meal. That will help for the stomach to start digesting. So that's going to be a starter, but we have to get down to more understanding about what's going to cause the cancer, because that's only the most common one. We're going to get to the second most common. Stay tuned. What I'd like to ask you as a favor, if you don't mind, you'll see below there's a place where you can make a comment. Please make a comment about this video, ask questions, whatever you'd like to do. It's very important for me, so if you don't mind, do that, because that is going to give me an indication what my next video must be talking about, and also covering a few things that you might be wondering about. Thank you for joining, and see you on the next video.